Hi, ladies. I'm going to be talking to you about sepsis today. And I'm going to tell you as we go along, you're going to figure out why I hit sepsis so hard. But the first thing that I want to actually show you is part of the reason why. So I'm going to go to my share screen. There we go. All right, so I hope that you can see this document. I'm just going to read it to you out loud. It says, a 39-year-old patient was admitted with a diagnosis of acquired pneumonia in the setting of presumptive influenza and concurrent sepsis. In the history and physical exam, let me just go ahead and pull it up a little bit. It is documented that the patient had sepsis and SIRS, meeting the criteria of leukocytosis, fever and tachypnea with pneumonia as the source. The sputum culture was positive for pneumonia, and the patient had a 6-day stay. All right. So the patient's been discharged, and you're abstracting what you need off the discharge summary, which is what a patient is given at the time of discharge. The diagnoses were influenza with pneumonia, bacterial superinfection, positive for pseudoneumonias, as well as acidosis, asthma exacerbation, hypoxia, and chronic bronchitis. So what I want you to notice that even though we read in our history and physical up there about sepsis, it was not listed as a diagnosis in our discharge summary. Sepsis and SIRS were not mentioned in the discharge summary and only mentioned sporadically throughout that progress note that we read from above. As it stands, these are going to be our diagnosis codes. Influenza with pneumonia, unspecified asthma, acidosis, pneumonia due to pseudomonas, hypoxemia, chronic bronchitis. So the reimbursement as it stands here is $5,694.01 due to those particular diagnosis codes. Okay, so if we query the physician and he thinks that we need to add sepsis, which would be our A41.9. So if we had all of those things, but sepsis was our primary diagnosis, our reimbursement would be $10,621.61. Just by adding sepsis, you actually will, the difference in the amount is $4,927.60. So let me stop our share. That's why sepsis and the coding of sepsis is so important to know the rules. Okay, now I'm just going to move out of the way and show you the board. I want you to understand, I know that it's backwards because I only have a front-facing camera and I can't figure out how to make it turn around, and I can't. I have a webcam on order to be able to do that. But for now, we're going to do it this way. I know it's backwards, but I will take pictures and I will send out pictures of this. So you'll have exactly how it looks. Okay. So here's our pyramid. Let me see if I can make sure that you can see the whole thing. Well, I'll move it down as we go on. So at the top of our pyramid, respiratory failure is an $8.7 billion diagnosis a year. Chronic heart failure is a $10.5 billion, and a pneumonia is a $10.5 billion. Heart attack is $11.5 billion. Okay, let's look at what sepsis is. $24 billion a year. Because of that, you have to follow paperwork, you have to have documentation, you have to know how to code sepsis. So if you are going to be coding in a facility that sepsis is coded regularly, then you need to make sure that you brush up on those guidelines. Okay, so I'm going to show you here, I have a list of key terms. Of course, again, they're backwards, but says key terms, and the first one says sepsis. I'm going to actually read you the definition of sepsis. It's due to infection, a severe case that indicates organ dysfunction. Okay? Severe sepsis. I actually don't have that one written down, but I have that one over on the other side, so I'm going to show you that in a minute. So let's skip severe sepsis. Septic shock is a circulatory failure associated with severe sepsis. Bacteremia is the presence of bacteria in the bloodstream after a trauma or an infection. Septicemia, a symptomatic disease associated with pathological microorganisms or toxin in the bloodstream. And SIRS is a symptomatic inflammatory response syndrome, a systematic response to infection or trauma with such symptoms as fever and tachycardia. Okay, did I really need to read you all of those? No, because those are actually part of some of your vocabulary words that you should be writing down or highlighting or getting to know. Okay. So I am actually going to bring us, I'm going to just roll us on over. So bear with the motion, please. Just knocked my trash can over, but that's okay. All right, I think I'm gonna have to go back some, guys. So just bear with me. I'm sorry, I'll get better at this as we go. But I just think it's so important to be able to see it on the board as we talk about it, even though it's backwards. It's important. Here we go. Okay, so sepsis defined. This is a little chart that I find absolutely critical, and guys, I have to tell you, I have this much on sepsis in my binder that I usually teach, so I'm trying to compact it down. Again, I know this is backwards. You will get a picture of it. So sepsis is a symptomatic response to infection. Severe sepsis is sepsis with associated acute organ dysfunction. Okay, let's look at the word acute. Do you remember what acute means? Like a cute boy comes and goes very quickly. So it's acute. It's onset very quickly. It can leave very quickly. Okay, so septic shock is a circulatory failure associated with severe sepsis. Okay, you have sepsis. You can't have severe sepsis without sepsis. You can't have septic shock without severe sepsis. So that is so important to me because it kind of gives you a guide of you can't have one thing without the other. It all starts as sepsis. I do want to tell you, I don't know if you've ever heard of urosepsis. That is an older diagnosis term that has been supposed to have been phased out, and you will not find that in the ICD-10 code book. Okay, so I want to move here to signs and symptoms. Again, guys, this is all in your book. I pulled it from there to write it down just to discuss it. But some signs and symptoms are fever, shaking, chills, confusion, pallor, tachycardia. What is tachycardia? That means fast heartbeat. Bradycardia is slow because Brady women, like the Brady Bunch, are slow, and tachy women are faster. That's how I was taught in the hospital when I was working on the cardiac floor. That's how I was taught to remember that. And hypotension. And some complications can include septic shock, respiratory failure, kidney failure, and hepatic failure. Okay, so what are some treatments? Antibiotic therapy by IV, fluids and pressors to maintain your blood pressure, activated protein C, X, and oxygen. I wrote oxygen, just so you let me fix that. That's hilarious. Guys, I tell you, some days, it's a Monday. It's a typical Monday. Okay, so I'm going to move you over to the middle board, and I want you to remember what I'm saying. I am going to send you pictures of the board so that you will have all of this, and you can write it down if you like. I have another chart that I am not going to put up today. I'm going to do that in a video for later on in the week. Okay, so I'm going to put you up like this. So, all right. That top statement says, we can use a sepsis code even if we have a negative blood culture. If your physician puts sepsis in his medical records, you code sepsis, even if you saw that the blood culture was negative. Only 28% of people with sepsis will have a positive blood culture. So you leave that decision up to the doctor, and you can always query the physician if you think there's enough proof for sepsis. But believe me, guys, that's where some money is at, and he knows if he can get paid for sepsis or not. But you can always ask. Okay, so our little circle here says sepsis coding challenges. These are some challenges that you have when you're coding sepsis. Coder's knowledge of anatomy and physiology. So, you know, knowing a lot about the body and the body functions and how it works is important. Some coders know more about one area than others. Another one is complexity of records review. A longer length of stay, which means there's a lot of records that have to be reviewed, and that more paperwork to make a mistake. Okay, availability of resources. Unclear definitions, if your doctor's not giving you clear definitions. Physician documentation challenges. There are extensive coding guidelines, and it's on the OIG hit list and payer target. What that means is they're watching for those sepsis codes. They're watching to make sure that all the medical records are going to be in line with saying that that patient can have sepsis. So, you guys have a 3 paragraphs due today on sepsis. I'm kind of giving you a little bit to go off of and a little bit of the things that you need to work on. I know that there's a lot of work, but I'm just telling you right now, there's going to be more work now. So those of you who haven't been turning in assignments, most of you are, remember, they have to be submitted. Submit your assignments. Even if you put done, I can say you were there, but you don't get credit for the assignment. You just get a little participation. Please, 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 please be on point this week. We are learning about infectious diseases, and it's very, very important. So this is only a little bit about sepsis. I'm leaving it up to you guys to get out there and do some research and find out about coding sepsis, because the best knowledge you can have is not what you know. It's knowing how to find what you don't know. So you may not know, but having the knowledge of going out and finding it on your own is invaluable. All right, have a great day. If you guys need anything, let me know. Bye-bye.